Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is the top 10 things you should know about stem cell procedures. Stem cell procedures for musculoskeletal conditions are now a reality. You see this more and more in the general public, professional sports, college sports. All these professional sports leagues have approved of their use, okay? Everyone from Bartolo Colon, an all-star, Hines Ward right before the Super Bowl, people who are competitive, weekend warriors, okay? So it's here. The first thing to know is that modern stem cell procedures have no ethical issues. So there's no fetal tissue that's involved in the use of these stem cells. It's only in adult stem cells or amniotic stem cell fluid that's derived from consenting donors after a scheduled C-section. Okay, nothing from the fetus. The second thing to know is that stem cell procedures are showing promise for degenerative and rheumatoid arthritis, for preservation of the joint, or for a restoration of the joint, such as cartilage. SI joint and spinal joints and discs are showing excellent results from stem cell procedures. Soft tissue procedures for tendonitis, such as Achilles tendonitis, rotator cuff tendonitis, elbow for golfers or tennis elbow, plantar fasciitis. All of these are showing excellent results from stem cell procedures. What you have is a procedure that is actually helping to restore and regenerate tissue, as opposed to when you do steroid injections, which doesn't heal anything. It's just a proverbial Band-Aid. This is much more. Ligament injuries, sports injuries, diabetic wounds, and stress fractures are all seeing excellent results. The third thing to know is stem cells really truly are a blank slate. They start from an undifferentiated state and they convert into any number of necessary cells, and a lot of it depends on what environment they are placed into. If they're placed into an environment of damaged cartilage, a lot of times they'll convert into cartilage. Damaged tendon, they'll help convert into tendon to repair. You can see that here. Blank slate, turn into skin, cartilage, tendon, ligament, muscle, whatever they need to. The fourth thing to know is that stem cell procedures can actually heal the injury. Traditional treatments with cortisone act as a Band-Aid, don't heal anything. The regenerative medicine stem cell treatments offer the potential to heal the damaged soft tissue and cartilage much more completely and much quicker than you can naturally. This is cutting-edge treatment and helps get athletes back on the field faster and avoid surgery, and can delay or avoid the need for joint replacement. Plastic surgery used to be 90% surgery, okay, and 10% injections. Now it's the reverse. It's 90% non-operative, such as with Botox injections and things like that. That's where we're headed with regenerative medicine. The fifth thing to understand is that current treatments do not use embryonic stem cells. The use of adult stem cells in research and therapy is less controversial than embryonic stem cells now because their production does not require destroying an embryo. Okay, there's no fetal tissue involved. Ethical concerns are non-existent now. The amniotic fluid stem cells are intermediate between embryonic cells and adult stem cells. They do have some potential to develop into different cell types, but they are not pluripotent. So none of the current stem cell methods being used in practice are embryonic. So they actually know when to stop replicating, as opposed to embryonic, which just often kept going and going and going and could actually form tumors. The sixth thing to know is there are 4 different types of regenerative medicine procedures now being offered. The first is bone marrow derived, where bone marrow fluid is aspirated from your iliac crest, which is in your hip area, and then it's processed immediately and re-injected. The stem cells are concentrated. Fat derived, where you harvest some fat, you spin it and process the fat to get the stem cells out of it and re-inject at the same setting. Amniotic derived, you don't have to aspirate anything. It comes from somebody else. It comes from consenting donors after a scheduled C-section. It's processed through an FDA-regulated lab and then cryogenically frozen and then thawed out a little bit prior to injection. Okay. And PRP therapy is sort of an indirect stem cell therapy. You do a blood draw from the person's arm of 30 to 60 cc's. It gets centrifuged, spun really fast in a machine called the centrifuge. That concentrates the platelets, And then what you can do is when it's injected, it actually pulls in the body's own stem cells to help heal. Seventh thing to know is amniotic derived stem cells have several amazing qualities. It's obtained, as I mentioned, from consenting donors after a scheduled C-section, processed at an FDA-regulated lab. It has a very high concentration of stem cells. It also has hyaluronic acid, which is what Synvisc and Hyalgan has. We have hyaluronic acid in our joints anyway, but injecting it can help preserve cartilage and even maybe promote some more cartilage being formed. The amniotic fluid also has growth factors and proteins in it, and it's antimicrobial. It's a very, very, very low infection rate as a result of antimicrobial properties. It's been used tens of thousands of times worldwide without really any adverse events, so it's been growing in popularity across the country for musculoskeletal. Eighth thing to know is small studies to date are showing excellent results for all these conditions: knee arthritis, elbow epicondylitis, which is golfers or tennis elbow, degenerative disc disease, plantar fasciitis, ligament injuries, rotator cuff injury, and Achilles tendonitis and tears. So it's been amazing in small studies of 20, 30, 40 patients. We do need to get some larger studies though. Ninth thing to know is that these treatments are not yet covered by insurance. Despite the exceptional results being reported, it usually takes insurance companies several years to cover new technology. We've seen this time and time again with things that are either FDA approved or regulated. They just don't get covered right away. Insurance companies like to use the word experimental, and this is nothing new. The cost of the procedures will range. If surgery can be avoided, that can save considerable cost and disability. I mean, these procedures may cost anywhere from $500 to $10,000, depending on what's being used and how many areas. The 10th is that stem cell procedures for musculoskeletal are outpatient and exceptionally low-risk procedures. PRP therapy involves a blood draw from yourself. Fat and bone marrow derived involve autologous tissue from yourself. Amniotic derived is immunologically privileged, though you don't see a rejection reaction. That's been shown tens of thousands of times. And it has a long track record now for safety and for efficacy. So that's been great for amniotic derived. And there's minimal adverse event potential with these procedures. The top pain management clinics in California are affiliated with the California Pain Network. There's multiple clinics throughout the state. Over 50 insurances are accepted with over 25 treatment options provided. Overall, the average success rates for pain relief and avoiding surgery are over 90%, and the pain doctors are board certified and award winning. Visit us online today at californiapainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.